Last night, we told you how disparities in cancer care on the south and west sides of Chicago are leading to more people dying there. Right now, cancer is the leading cause of death in 5 South Side neighborhoods. As our Audrina Sinclair reports, the University of Chicago is there, in the thick of it, building a new center to save lives.
The south side of Chicago, unfortunately, because of years of segregation, racial and economic segregation, has really been sort of a desert for healthcare. Some of it is really financial, right? There's a lot of concentrated, persistent poverty in our neighborhoods.
And Dr. Nita Lee is tasked with tackling that problem. She's leading community outreach for the University of Chicago Medicine's new cancer center coming to Hyde Park in 2027.
How is this cancer center right here on the south side of Chicago going to help address some of the disparities that we're talking about?
Part of our mission is to really understand the burden of our cancer in our whole catchment area. Like zip code level, census tract, like where are people really getting the highest incidence of cancer? What are the cancers that we're seeing and what are the trends?
And when we look at cancer mortality and the amount of people dying from cancer in the city of Chicago, this map here gives us a better idea of where it's happening most. You'll see the darker the blue areas, the more people dying from cancer. And these areas are all concentrated on the west and the south side of the city in neighborhoods like Roseland and West Englewood on the south and Austin and North Lawndale to the west.
Our job is to really think about bringing that information to our cancer center and then having these great researchers really think, okay, how can I solve this problem?
One way is to include more Black and brown people in crucial clinical trials that study cancer treatments and their effectiveness. Right now, only 5% of people participating in these cancer trials are Black. Only 6% are Hispanic, compared to 73% who are white.
How do you look at anything that you're doing research-wise, patient care-wise, clinical trials-wise, through this lens of like how to make sure that more people can have access?
Also hoping to get people more access and better quality of care is Paris Thomas of Equal Hope.
We serve the communities on the west and south side of Chicago, primarily those that are Black and brown, and usually those who are considered under-resourced, disinvested in. That is where most of the women that we see are dying from these diseases and where we can make the biggest impact.
Right now, Equal Hope is helping 1,800 women, like Roseland resident Janella Jones-Riggins. A year ago, Janella found a lump in her breast but had no health insurance.
They made sure that I got everything that I needed.
We're able to pray for things like mammograms or even cervical screening so that women don't have to. But then we also take care of costs such as transportation.
Where are you at now in your journey?
My prognosis is well. My last scans were clean.
A life saved with the hope that more people will get the help they need no matter where they live.
That was Audrina Sinclair reporting. The amount of people diagnosed with cancer on the south side is projected to increase 19% in the next 5 years. UChicago Medicine says that's one reason why the Cancer Center, an $815 million investment, is crucial in the fight to save lives.